Hi everyone, I am Dr. Andi. It is time for today's Facebook Live. While I give all of you the chance to log on and join us, I'll give you a brief introduction about me and a little bit about my background. So I am a naturopathic physician. I've been practicing in Toronto, Canada for over 12 years now. My focus used to be more so in sports medicine. I was a dancer, I was a personal trainer, so that was a really big interest of mine. And then I slowly transitioned more into hormonal balance, men and women's health. And so in our practice, we have a functional medicine practice. We focus on hormonal health, metabolic nutrition. We have sort of an anti-aging, longevity, and regenerative medicine component. We work a lot with those who suffer from cognition issues, cognitive decline, so reversing and preventing Alzheimer's. The foundation really of our clinic and our practice is really that low carb and keto lifestyle. I personally have been keto for many years. My own sort of health journey took me in that direction. And then I stumbled into gluten-free and then low carb and then naturally transitioned more so into keto. So that was something I've been introducing into my practice for many years, and the ability to then add in obviously exogenous ketones was a really big and significant change for my patients. Obviously, for those of you who have tried a ketogenic diet, it's not necessarily the easiest thing for some people to follow. For those who are starting to make new diet changes or new lifestyle changes, expecting someone to sort of go keto right off the bat really wasn't all that realistic for my patients. So allowing them to have the benefit of being in nutritional ketosis before they were able, before they're able to make those dietary changes was quite helpful. Okay, I can see your questions coming in, so I'm going to get started. I want to try and get through all of them as best I can. Can ketones have a negative impact on male fertility? So that's a great question. So no, there shouldn't be any detrimental impact on male fertility in any way. Obviously, they need to work with their reproductive endocrinologist and work with their fertility clinic as well, if that's something that they're going through, that they're concerned about. But no, there's not a negative impact on fertility. I haven't seen any studies specifically looking at male fertility, like increased sperm quality or motility, anything like that directly linked to beta hydroxybutyrate. But now that you've brought that up, that's some research I'm going to start digging into to see if there's a sort of a direct link or correlation in that sense. But no, there shouldn't be any detrimental impact on male fertility. But of course, work with your healthcare provider, make sure that they say it's safe for you. What is the best thing to do when you hit a wall with weight loss and you're low carb and drinking ketones? So great question. What happens when you hit a plateau? So the first thing I always like to remind people is that ketones, one, aren't a weight loss supplement, and two, they're not going to be able to manage or fix sort of all of or any underlying health conditions that you might be experiencing. So some of the things that contribute to weight gain, for example, are hormone imbalance, hormones being thyroid issues, someone is moving into perimenopause, menopause, into andropause, so you're losing your testosterone, you're losing your estrogen. All of these things will contribute to weight gain. High stress, that causes high cortisol levels, and cortisol causes you to store fat around the middle. Insulin resistance, so spiking insulin. Also a storage hormone, so it's causing you to store around the middle. Inflammation, microbiome dysfunction. Those are all things that will contribute to weight gain. So when someone tells me, I'm doing all the things, I'm low carb, I'm exercising, I'm taking ketones, I'm doing all the things, I can't lose weight, you have to look at the underlying factors. You have to look at the hormones, you have to look at your lifestyle, any of the things that might be going on that you need to address. And again, for example, if you've moved into perimenopause, menopause, or andropause, obviously your ketones can't replenish the hormone loss. So it's very important to take those things into consideration. I've said it once, I've said it a million times that weight loss is hormonal. You have to look at the underlying hormonal picture and the other underlying factors that will actually contribute to weight gain. So it's important to do that. Also, somebody has been losing weight significantly and then they hit a plateau. The two things I'll ask them to do, if they're not already doing that, is fasting. Intermittent fasting, 16 hours from dinner till the first meal the next day, 24 hours once a week, and then a reboot once a month. And that's a really great metabolic reset. And then I'll also ask them to track their food for a week. I don't generally make my patients track their food. I rarely, if ever, I don't think I ever have made a patient count calories. I'm more concerned about the quality of food. over the quantity, but there does come a time where sometimes you have to take a look. Sometimes your macros need to be adjusted. So just track your food for a week just to get a better sense of really what is going in and out, and see if there are any adjustments that need to be made there. So there are a few different things that you can do when you do sort of hit that plateau. So you follow a strict and clean keto diet, but your ketone levels never read higher than 0.5 or 6. You have PCOS. So the thing about measuring ketones, I don't think you're doing anything wrong if you're finding that you're not going into ketosis. So first thing, if you are drinking your exogenous ketones, you measure your blood ketone levels within about 30 to 45 minutes to check the level of ketones in your system at that point. The other important thing is to make sure you're measuring blood ketones and not urinary ketones, because we know that although ketones are water soluble, when the body becomes more keto adapted, we release fewer ketones in the urine. The other thing in the morning, so make sure you're checking those blood ketone levels first thing in the AM, right when you wake up, to really get a better sense of what those levels are. And then also to remember that our ketone levels, getting into nutritional ketosis, is very different for everyone. It depends on your metabolic state, where you're coming from. For some people, it might take them, a month or two to get into ketosis. For other people, it might take them 6 months. It just really, and that's nutritional ketosis, obviously, because if you're drinking exogenous ketones, it will elevate your blood ketone levels. But from a nutritional ketosis standpoint, just know that it can take time. If you're insulin resistant, for example, you might need even fewer carbs than what you're already consuming. So you really have to take a look at what you're consuming, track your food a little bit. You might have to make a few adjustments, but also don't be disappointed, because everybody will transition at a different rate. Everyone's metabolic state, everyone's health is different. So you just have to sort of be patient with yourself and then work with a provider who understands the ketogenic diet, who might be able to help you or guide you, in case maybe there are a few things that you could tweak to help you get there a little bit faster. And fasting will also help. I mentioned that before about the weight loss plateau, that fasting will also help transition you into nutritional ketosis. Is there a concern for someone with a heart condition about the energy boost from the free cell formula? So I would say that depends. If you have a medical condition, you do need to make sure you're working with your healthcare provider, make sure that they have that you have been cleared for, activity and exercise. So your healthcare provider has to have said at what state you are. So I don't know what kind of heart condition you're referring to, so it's hard for me to say specifically if it's unsafe for the person that you might be referring to. We do have a lot of patients who have a certain type of heart condition. We still give them exogenous ketones. In terms of an energy and a fuel, we know that the heart can often prefer beta hydroxybutyrate over glucose. So there may be instances where that is safe for you, but again, it depends on what that heart condition is. I'm not really sure just based on what you've written. So you do have to work with your healthcare provider, make sure they've said it's safe for you, and that there are no concerns in terms of optimizing metabolism, energy, and things like that. So again, work with your healthcare provider. As a general rule, there shouldn't necessarily be a contraindication that you have to work with your doctor, just again, because I'm not familiar with just because you didn't mention what the actual heart condition was, so it's hard to say. So work with your healthcare provider, but there are instances where it's perfectly fine and safe. Are there studies that have shown it helps with lupus? So I'm going to wrap the lupus question more into autoimmune condition. So what we'll often hear with autoimmune is that we don't know what causes an autoimmune condition. We don't know what is underlying an autoimmune condition. So that's not entirely true. I would say with almost all of my patients with an autoimmune condition, there was a stressful event that triggered that immune dysfunction and triggered that autoimmune reaction. So there are quite a few things underlying autoimmune. So when you do have an autoimmune condition, you can't really, turn it off. But there are a lot of things you can do to manage that autoimmune condition overall. So we know underlying autoimmune, there's a preceding, chronic stress. Either there was a death or a divorce or something like that, or just really long-term stress that led up to the diagnosis or the onset of symptoms. We also know that we have underlying inflammation. We have mitochondrial dysfunction, and we also see low BDNF levels. So BDNF stands for brain-derived neurotrophic factor. It's something that we see in cognitive decline. You can actually check the genes for that to see if genetically you're predisposed to low BDNF just in general. And then there are things that we can do to optimize all of those things. So if it was a stressful trigger, obviously you have some lifestyle changes that you need to make. Diet, inflammation make a huge difference in autoimmune. And we also know that beta hydroxybutyrate has been shown to optimize and upregulate BDNF. Fasting has been shown to do the same thing. We've also seen that beta hydroxybutyrate has been shown to improve mitochondrial function. Again, something that is underlying in an autoimmune condition is mitochondrial dysfunction, and so it encourages the production as well of glutathione, which is used by the mitochondria to produce energy as well, and that's one of our most important antioxidants. So some of the things underlying those conditions, we have seen studies showing beta hydroxybutyrate can support. So will ketones cure an autoimmune condition? Absolutely not, but can address some of those underlying factors that we see when somebody is suffering from an autoimmune condition. So that's very important. There are a lot of options in these instances as well. I'm always asking my patients to also make the dietary changes. You need to be on an anti-inflammatory diet so you're not triggering that autoimmune condition as well. How do you recommend beginning intermittent fasting? So intermittent fasting, usually I have my patients start off by just kind of diving in, depending on where they're coming from. And so intermittent fasting, I have them do 16 hours from dinner until the first meal the next day. I mean, if I'm working with somebody who's, they've been eating McDonald's 24/7 for the last few years, we probably won't start at 16 hours. So what I'll probably have them do is start with 12 hours. Some people don't make it to 16 hours when they begin, so I'll say try the 16 hours, see how you feel. I had a patient come in a few weeks ago and tell me she felt awful at that point. She just felt, hangry and hungry and things like that. And I said, okay, so drop it down to 14 or 12 hours. And we do that for a few weeks. So you just find the amount of time. The goal is not for you to feel unwell. It's not for you to feel starving, angry, jittery. So if you need to do a slow progression, then do that. Everybody moves at a different pace. Everyone moves at a different rate. So generally I'm aiming for 16 hours, sometimes more when they can do that. But if you're not able, start at 12. And then once you're comfortable, work up to 14, and that might be a few weeks. Work up to 14. When you're comfortable there, work up to 16. So you can make that a slow progression. Once you get there and you feel good at 16 hours, then I have people start to play around with introducing that 20-hour fast or 24-hour fast once a week. And then we sort of start talking about engaging in a reboot for those, or sort of that more extended fasting for those who aren't able to sort of dive right in. And I find that that's a really great prep to get you ready for the reboot as well. If you've never done any of that extended fasting, then to use those sort of weeks before to play around with fasting before you engage in that reboot if you're a little bit nervous. That's a great way to prep for it. So that's generally how I have my patients start. I do have some guides on fasting and things like that. And again, it's not, there's a general outline I give patients, but everybody is different. So it's not sort of cookie cutter for everybody. And so you just have to find what works for you and what works right for you. So Debbie from New Jersey, you had 60 pounds off. Oh, now you've gained 10 pounds. You sort of fell off, I think, over the holiday, and what to do. So you're looking again to sort of get back and refocus. Same thing, like I said before, fasting is the best way to restart fasting, and then start taking your ketones. I find that those are the easiest ways. The way I introduce diet change for people who are new or people who have sort of fallen off and need to get reintroduced to some of those healthier habits is intermittent fasting, drinking the ketones in the morning during your fasting window, and then you have 2 meals left in the day, and just make sure one of those meals doesn't have a carb in it. That's all. So if you want to have a sandwich for lunch, no problem. You end up having like a little bit of rice or some pasta for dinner, that's fine. It just means that your lunch was carb free. And that's a very easy, simple way to start transitioning patients into low carb. Eventually that means they're only eating carbs once a day, and then obviously work on portion control as well. I don't want someone eating a whole pot of rice for dinner. And then we work on portion control from there and slowly start to adapt. But usually that's a simple, easy way. It doesn't feel too restrictive, very easy to follow. And that's generally what I have my patients do when they're starting. Can you talk about symptoms of switching over to a keto diet? How to handle the stomach issues? So I'm not sure the stomach issues you mean. I don't know. So there are a few things there. So switching over to a ketogenic diet, I do generally have people start taking exogenous ketones. That does help with the transition into nutritional ketosis and making all of those changes. So transitioning over, some of the things that you might experience are keto flu. We hear people talk a lot about. So when I have people transition, I'm always putting them on electrolytes. I have them put their Mitoplex, mix it right in with their ketones, magnesium, a B complex, and a multivitamin. And that's just like basic foundation. Everybody starts on that. And then we work with other health conditions that they're trying to address and what else we may need to add in. But that's the foundation to prevent keto flu, keto rash. And most of my patients that I've had start with that process I haven't seen experience sort of the keto flu in that way. If you're having digestive issues, it sort of depends on what your issue is. If you don't have a gallbladder or you're having some gallbladder issues, introducing higher fats might cause a little bit of diarrhea. So we do see that happen as well. So if that's the case, you probably need a digestive enzyme with ox bile in it. So just make sure that you get some ox bile in. That helps a lot with fat digestion. If you don't have a gallbladder, I never encourage anyone to follow a low-fat diet. So if you don't have a gallbladder, don't let that be something that discourages you from following a higher fat diet. You just need to take some ox bile, and that will help you make that transition. Can you drink ketones after surgery? Have to work with your healthcare provider to make sure that that's safe. Immediately after, no, probably not. Usually with the surgery, anytime, sort of the 3 to 5 days leading up and 3 to 5 days after a surgery, they're asking you not to have any type of supplements or anything like that in your system. So I'd say probably not sort of right before and right after. Once you've healed and recovered, definitely safe to start taking them again. But of course, work with your doctor, make sure they say it's safe for you. Can stress cause the gut not to function? And can ketones help in gut function? So 2 questions there. So to answer the first one, yes, absolutely. There's a direct correlation between stress and gut. So absolutely, when people are stressed, one of the most common things we see is gut disruption, whether it's constipation, diarrhea, bloating. But yes, absolutely, there's a direct correlation between gut health and stress. We see changes in the microbiome in really high stress. So absolutely. So lifestyle and stress management is really important when it comes to gut function, if that's an issue that you're experiencing or have to deal with. And then can ketones help in gut function? There's some really interesting research looking at the role of beta hydroxybutyrate on the gut and then ketogenic diet on the gut. BHB has been shown to encourage the production of healthy gut bacteria. So there's some really positive research looking at the beneficial role that BHB might have on the microbiome. And they've also shown that people who follow a ketogenic diet have a different microbiome from those who don't, and they're actually calling it the keto microbiome. So there are actually changes we're seeing in that gut flora for those following a ketogenic diet. So yes, there is a direct impact on the gut if you are keto versus following another diet, or if you're consuming beta hydroxybutyrate, which can encourage the production of healthy gut bacteria. I'm not saying that's going to solve all of your gut problems. I'm not sure what's happening with your gut. We're just talking in general in terms of gut health. That could mean a million things depending on what's underlying. You could have SIBO, colitis, I don't know. So there are probably other things that you need to be managing there as well. But the research does show that there is benefit from beta hydroxybutyrate when it comes to gut health overall. But again, depending on what the gut issues are, there might be some other things you need to do just to help heal the gut just based on what's going on. It's hard to stay in ketosis with stress, autoimmune, and thyroid, or is it hard to stay in ketosis? No, definitely not. If you're very stressed, autoimmune conditions, stress is challenging because with stress, we're spiking a lot of cortisol, so that can make it a bit of an issue for you. Autoimmune, thyroid dysfunction, not really. So you should be able to get into nutritional ketosis. Again, if you're not, this is where the exogenous ketones are really quite helpful for you, so you still get the benefits of the beta hydroxybutyrate in your system. But actually, to be honest, most of my chronically ill patients, autoimmune, my Lyme patients, they're all put on a ketogenic diet. That is just like foundation for them right off the bat, and they're able to get into ketosis. But that's really a foundation when there's a chronic illness. You do low carb and you have Crohn's, and ketones have helped you so much. That's fantastic. I love hearing stories like that as well. So feel free to share your stories today as we go through. What drinking ketones are you referring to? So I'm referring to the Prove It ketones. There are a few different, the Keto Nat, Obviously, there are keto drinks and the new keto kick as well. So those are the exogenous ketones that I'm referring to. So you can either have a powder you mix with water, or you can have the pre-mixed one with beta hydroxybutyrate in it when we talk about drinking or consuming our exogenous ketones. So the products have pure beta hydroxybutyrate in it. So you're actually drinking ketones. So you're not relying on your body to create ketones or to go into nutritional ketosis. Naturally, you're putting yourself into nutritional ketosis by consuming the ketones. And obviously, we weren't able to do that until about 5-10 years ago. It was essentially the ketogenic diet that was accessible to the general population to be able to have ketones in our system. Now we're able to drink pure beta hydroxybutyrate to get our bodies into nutritional ketosis. So are ketones safe with diverticulitis? Lots of gut questions today. We have lots of gut health questions going on. So generally, yes, but safe with diverticulitis. But you have to work with your healthcare provider and make sure that they personally said that that's safe for you based on your overall health. But in general, yes. When you're intermittent fasting, you feel like your blood pressure gets too low. I'm not sure what too low is for you, but make sure if you're fasting that you're replenishing a lot of your minerals. Make sure you're getting enough of your sodium, your electrolytes in. That's often very helpful. When I hear things like that, I'm often concerned about POTS and wondering about other underlying conditions. So there's a bit more information to sort of flesh out there about that, the drop in blood pressure. But yes, when fasting, just make sure you're getting tons of those minerals in. Depends on how long the fast is. And my question is if intermittent fasting is helpful for you and doesn't cause that same drop in blood pressure for you. But main thing is make sure you're getting your electrolytes in, you're getting enough sodium. And I think those are the key things to really help maintain, again, a blood pressure, although I'm not sure to which level your blood pressure is dropping. You're doing a 17-hour fast, 1 24-hour fast a week. That's great. And you're about to try the reboot. That's fantastic. That's always what I recommend as a prep for reboots for someone who, for somebody who is a little bit nervous to start or they've never fasted before. This is a really good prep to get you started. Can you tell me the importance of tracking ketosis with the strips? What's the purpose? So I don't make my patients track all the time. So with strips, I'm assuming you mean urine strips. I don't think you have to track with urine strips all the time. First of all, I think I prefer the blood strips. I talked about that a little bit earlier, so feel free to rewind just to hear a bit more about urine versus blood tracking of BHB. I don't think you need to do it all the time. I never make my patients do it in the beginning if they're following a ketogenic diet. Within the first 6 to 8 weeks, they're probably not in ketosis anyway, so don't waste your money on the strips. And then after 8 weeks, we can start testing because we just want to know if you're in nutritional ketosis. And if you're taking exogenous ketones, I often just like to check just to see what my blood level is after I take them. So the checking I don't think is necessary. You don't have to do it. Sometimes people like to because they want to see their blood ketone levels. Once I know my patients are in ketosis, then I don't really bother making them check. I rarely check my blood ketones anymore, but I've been keto for many, many years. I just kind of know when I'm in and not in, and I do cyclic keto, so I cycle in and out. So I don't think that you have to check your ketones all the time. I don't think that it's 100% mandatory or essential. Some people just like to know. And for those who like the numbers and they want to correlate, then feel free to go and check them. But again, I don't think that everyone has to do that. So pros and cons of ketones, hypothyroidism, Hashimoto's. So I talked a little bit about autoimmune conditions before. So I would say rewind a little bit. Hashimoto's is autoimmune hypothyroidism. So I touch a little bit on that and the role that beta hydroxybutyrate can play there as well. The only sort of con I would say with thyroid is when someone follows a ketogenic diet and they don't do it sort of properly. They're not eating their good healthy fats. They're just sort of eating chicken and lettuce all day long. We know that we need fats to make hormones. So when we follow a diet that's very low fat, that's when I often see the hormone disruption. I might see, thyroid disruption, or you might see the hair loss. You'll hear people complain about some of those things, but we don't usually see that if you're following the diet with with those high healthy fats. So that's a really important piece when you're transitioning into a ketogenic diet. And we don't really see that with exogenous ketones. So I have a lot of patients, again, with Hashimoto's or hypothyroidism. following ketogenic diet, but you have to work with your healthcare provider. Make sure that they say that that's safe for you. I also did a presentation on thyroid as well and ketogenic diet and some of the misconceptions about, our thyroid needs carbs to function. That's not actually true. Carbs need thyroid to be digested, so it's a little bit in the reverse. So feel free, if you can track that down, to watch that as well to get a bit more in-depth information about thyroid, beta hydroxybutyrate, and the ketogenic diet. Do you want to drink ketones every day and for how long? So yes, if you are not in a ketogenic diet and you want the benefits of beta hydroxybutyrate in your system, then yes, you want to drink them every day because your body will use the BHB as a source of fuel. So you'll consume your ketones, and depending on if you're using it as a pre-workout or something like that, the amount of time that they're in your system will vary. It could be 2 hours, could be 4 hours. If you're heading to the gym right after you take them, probably a little bit less because your body will burn them as a fuel source. So if you want them in your system for longer periods of time, then you want to take them daily. And then if you want them in your system more frequently in the day, then often taking it twice a day is helpful. So I usually recommend first thing in the morning and then sometime in the afternoon, when you might get a bit of an energy dip, or if you're working out in the afternoon, then that's often a time I'll recommend people take it as well, to sort of pre-workout if you're working out in the afternoon. So twice a day is a great time, and then obviously in the afternoon, making sure that they're caffeine free. So if somebody is new, just take it once a day. Twice a day, I really think is optimal. And then I've had some questions also. Well, what if I stop taking them? Nothing bad happens if you stop taking them. You just don't get the benefits of having BHB in your system anymore. That's all. So you don't go through a withdrawal or anything like that. So I recommend taking them long term. So if you forget a day or you skip a day, that's not a problem. But as long as you want to experience those benefits of beta hydroxybutyrate, that's how long you'd want to make sure that you're continuing to take it. Could there be a correlation between Mitoplex and swelling ankles? No, not usually. My answer is always twofold. I would say when it comes to taking something and putting it in our system, even if 95% of people who take it respond in one way, that doesn't mean everybody is going to respond that way. So anyone can have any reaction to anything they take. I have patients that take magnesium and it causes anxiety, even though taking magnesium is usually very calming and helps people sleep. So people can have reactions that are the complete opposite of what something is supposed to be doing in your system. That said, Mitoplex does not usually contribute to swelling in your ankles. You could be dehydrated, and obviously taking the Mitoplex is what you're taking to help replenish those minerals. But I would also just take a look at some other things if you're sitting a lot, things like that. And then also just make sure you're working with your doctors so that you confirm that there's nothing else going on, because there's some other conditions that can contribute to swelling. So no, Mitoplex doesn't normally do that, but work with your doctor, make sure that there's nothing else going on, nothing else that needs to be addressed. How do I find a doctor who works with keto in my area? Good question. You might just have to sort of Google and search to find somebody who is an expert in your field. I mean, most people have gone virtual now during COVID anyway. So even if they're not in your area, probably very easy to find somebody that you could work with even virtually. You could find a functional medicine doctor. Usually they're more well-versed in keto, so they might be able to guide you. But essentially you're going to have to Google and go on a bit of a hunt in your area. But again, most people are virtual now, so you probably won't have any problems finding somebody if you're okay working with somebody who's not in your area. So if you can't find someone close by, there are a lot of people who have gone virtual now who'd be able to help you, one-on-one. Can I start this from the beginning? If you mean the live today, yes, it will be posted on the Prove It page. So yes, absolutely. When the call is done, you can rewind and you can rewatch it. So some of the things that I mentioned earlier, you'll be able to rewind. So yes, you can watch it. You can watch it afterwards. So that is it for our time today. So I actually am going to answer one more question. So can you become immune to beta hydroxybutyrate? And not sort of feel the energy? So it's not that you're becoming, no, you're not going to become immune to BHB. BHB is sort of an energy or fuel source. As your body needs it, it will use it. So your body won't become immune to making use of that source of fuel. What I think that happens with a lot of people is that their set point changes. Oftentimes with my patients, I'll have people say, I don't feel like I've gotten better. And then we go back and I'll say, well, here's, what you said was on your list. You rated your energy at a 2 out of 7. Now you're at a 2 out of 10. Now you're at a 7 out of 10. And so you often don't realize the changes. So you're expecting this massive boost without realizing that your new set point is higher than it used to be. So that's often what I see happening when people say that they don't feel the same kind of kick that I might have felt initially. But no, you don't become immune to them. And then I also always encourage people to take a look at other lifestyle factors, stress, other things that are impacting your energy, iron, B12. There are a lot of things that can cause low energy. So just make sure you don't have other things underlying that need to be addressed, that obviously that the ketones can't fix. So make sure you work with your provider and make sure that there's nothing else that needs to be addressed that might be causing some fatigue. So that is it for our time today, everybody. I know there are a lot of questions I missed. Hopefully I can get through some of them. So we'll go back and try and answer. But thank you for joining and listening today, and enjoy the rest of your week.